Hi, this is our news report on racism in healthcare. Our first article is titled Minneapolis Declares Racism a Public Health Emergency. This article lists the detrimental effects racism has on the survival of people of color and their mental health. Basically, they put an emphasis on the severity of discrimination and noting the inequality in healthcare access. There's been increased mental health issues among Black people with a lack of accessibility to healthcare. So, since the killing of George Floyd, there's been an increased rate of depression and anxiety among the Black population, but also a lack of accessibility to healthcare. So, they say in the article, we're expected to not only present with symptoms, but also have nowhere to go because of lack of access, the stigma, and barriers associated with it.
Thanks, Haley. So in our article, Social Inequalities Explain Racial Gaps in the Pandemic, Dr. Benga Ogadegbe, the Director of Health and Behavior at NYU School of Medicine, researched infection among Black and Hispanic patients. His team did a study that looked over the medical records of 11,547 COVID-positive patients between March 1st and April 8th. Where the results showed that there were equal rates of mortality among every racial group, but there was disparity in rates of infection. Black and Hispanic patients were 60 to 70% more likely than white patients to be infected, and these numbers can be attributed to social and economic factors. They proposed that this could be avoided if we had a better approach to social welfare and healthcare in the United States.
Connecting with the cause material, the cause and factors that are mentioned, such as psychological well-being that influencing the Black community, and that can be because of the racial gap. The particular reason or circumstance have a significant impact. An eco-social perspective illustrates how low-income communities can be affected. For instance, access to health. Moreover, eco-social model view on countries' politics and policies can also have a big impact on the public health, as it makes policies that can ultimately influence the community, such as systemic racism, which causes discrimination, segregation, and various outcomes, including social and environmental factors, such, for instance, housing, education, health, employment, and also public safety.
We chose this topic because it accurately depicts the inequalities and discrimination within healthcare. It shows how poorly we've taken care of our Black community, and both articles urge that steps must be taken to end racism, which is something that we can directly impact in the field of public health.
So how is this related to public health? Working in the field of public health, we are expected to serve the population in our communities. Our textbook quotes the Center of Disease Control and defines public health as the science of protecting and improving the health of families and communities through the promotion of healthy lifestyles, research for disease and injury prevention, and detection and control of infectious diseases. These articles show us we are falling short of meeting these demands of the populations and that there are areas where we can improve. Research proves that there is a disproportionality affected by racism, stigmatization, lack of accessibility, which all lead to worse health outcomes. The research Dr. Ogadegbe has conducted gives reason for policy changes that Minneapolis is creating and could be creating a standard for the rest of the country. So it's important for us to pay attention and to learn so that we can continue to make these changes and provide equitable resources.
Looking at the significance, in the first article, we see that Minneapolis is declaring racism a public health emergency to address that they're trying to restructure the criminal justice system to bring down police brutality and profiling, as well as reserving arrests for only major crimes and to minimize community violence. They're looking over policies with a public health perspective that could be targeting and over-policing and criminalization POC.
This impacts people of color throughout various communities, but especially those living in poverty. It also affects those who have been having to work jobs that require excessive exposure to COVID. And during the pandemic, a lot of our Black Americans have been left to work the jobs that do require excessive exposure without the required and appropriate protective gear, making their exposure rates a lot higher.
So there are some unintended consequences that can happen from a lack of response, primarily further damage to Hispanic and Black communities. We are seeing a disproportionality of health outcomes that are leading to these populations having early death and decreasing quality of life, which can be quantifiably described in disability-adjusted life years or DALYs. It can show how diseases and wellness can affect lifespan. And from research, we're seeing that Black and Hispanic communities are having more years lost, which will continue if we don't do something about it. Lack of response will also create more stigmatization and racism towards people of color if a stance isn't taken, and because it allows more people to undermine these issues if they aren't being recognized. Lack of response can also affect the individual, community, and societal attitudes and bring about a lack of trust towards policy, organizations, and government. People will question more about the government's role in their lives if they aren't seeing that anything is being done. And here are our key discussion questions and then our references. Thank you so much for listening.